There comes a point in life, usually after the age of 60, when your body begins changing in ways you can't see or feel. It doesn't happen overnight, and it rarely announces itself with pain or obvious symptoms. Instead, it happens quietly beneath the surface. A medication you've taken for years without any trouble may suddenly begin affecting your body differently. The prescription hasn't changed. The dosage hasn't changed. What has changed is the body taking it. That silent change can have consequences that are far more important than most people realize. In some individuals, it can mean the difference between maintaining a healthy heart and gradually increasing the risk of a serious cardiovascular event. The frightening part is that these changes often happen without warning. You may feel perfectly fine while your body slowly becomes more sensitive to medications that once worked exactly as intended. Today's discussion isn't designed to create fear or make you question every prescription sitting in your medicine cabinet. It's about understanding how aging changes the way your body responds to common medications, especially after 60. When you understand what's happening inside your body, you're in a much stronger position to ask the right questions, recognize potential warning signs, and work with your healthcare provider to make informed decisions. Welcome to Dr. Andewala. On this channel, we take complex medical research and translate it into clear, practical information that anyone can understand. Every week, we explore evidence-based health topics focused on healthy aging, heart health, nutrition, medications, and disease prevention, so you can make better decisions for yourself and the people you care about. Before we begin, if you enjoy straightforward medical information, without sensational headlines or confusing medical jargon, take a moment to subscribe to Dr. Andewala and turn on notifications. Every new video is designed to help you stay healthier, avoid common medical mistakes, and better understand how your body changes as you get older. Now let's get started, because one of the medications we'll discuss today is taken every single day by millions of adults and is rarely questioned despite the fact that its effects may change significantly with age. To understand why these medications deserve another look after 60, we first need to understand something most people are never told during a routine office visit. The body you have today does not process medications the same way it did 20 or even 10 years ago. Aging changes nearly every major organ system involved in handling medications, and those changes happen gradually enough that many people never notice them. Your liver, which serves as the body's primary chemical processing center, slowly becomes less efficient over time. Many medications depend on the liver to break them down into forms that can be safely removed from the body. As liver function gradually slows, some medications remain active longer than they once did. A dose that was perfectly appropriate years ago may now stay in your bloodstream for a longer period, increasing its overall effect. The kidneys also experience natural age-related changes. These remarkable organs filter waste products, remove excess fluid, and help eliminate medications after they've done their job. Beginning later in life, kidney function gradually declines in many otherwise healthy adults. Even when routine blood tests appear normal, the kidneys may process certain medications more slowly than they once did. When both the liver and kidneys become less efficient, medications can slowly accumulate inside the body. Nothing dramatic happens overnight. Instead, each dose may linger just a little longer than expected. Eventually, what was once considered a normal daily dose may begin acting more like a stronger one, simply because your body is clearing it more slowly. But changes in medication processing are only part of the story. Aging also affects the cardiovascular system itself. Blood vessels gradually lose some of their flexibility. Arteries become stiffer. The protective inner lining of blood vessels becomes more vulnerable to inflammation and damage. Even the body's ability to regulate blood pressure and circulation changes with time. All of these changes influence how medications behave after they enter your bloodstream. A prescription that interacts with blood vessels, heart rhythm, fluid balance, or blood clotting may produce a much different response in someone who is 70 than it would in someone who is 50. This is where many misunderstandings begin. People often assume that if they've tolerated a medication for years, it must still be the perfect choice today. That's not always true. The medication itself may still be valuable, but the body's response evolves over time. In medicine, context matters just as much as the drug itself. The exact same prescription may provide tremendous benefit in one stage of life, while requiring closer monitoring during another. A dosage that was ideal years ago may deserve reassessment today. None of this means the medication suddenly became dangerous. It simply means the balance between benefit and risk can gradually shift as the body changes. Unfortunately, these changes are easy to overlook because they happen so slowly. Most prescriptions are renewed year after year without major adjustments, because patients continue feeling reasonably well. Physicians focus on immediate concerns during busy appointments, while the gradual effects of aging quietly continue in the background. At the same time, the natural risk of cardiovascular disease rises with age. Heart attacks, strokes, irregular heart rhythms, and circulation problems all become more common after 60. When medications that influence these systems are layered onto an aging cardiovascular system, even subtle changes can become meaningful. Sometimes those changes increase blood pressure without obvious symptoms. Sometimes they alter blood flow. Sometimes they influence heart rhythm, clotting, or fluid balance. Individually, these effects may seem small. Together, over months and years, they can gradually increase cardiovascular strain without attracting attention until a much larger problem develops. That's why today's conversation matters. We're not simply reviewing a list of medications. We're exploring how the body itself changes with age, and why those changes deserve thoughtful discussion with your healthcare provider. Knowledge allows you to participate in your own care, rather than simply following routines that may have been established many years ago. Before we discuss the first medication, I want to emphasize one important point. Nothing in this video should be interpreted as advice to stop taking any prescribed medication on your own. Suddenly discontinuing certain medications can be far more dangerous than continuing them. The purpose of this discussion is education, not self-treatment. Instead, think of today's video as preparation for your next doctor's appointment. When you understand how medications work and why their effects may change over time, you can ask better questions. You can discuss whether your current prescriptions are still the best fit for your health today, instead of assuming that what worked years ago automatically remains the best choice. The first two medications we'll cover are among the most commonly used in adults over 60. Millions of people take them every day. They're widely available, often considered routine, and in many situations they remain extremely useful. Yet under certain circumstances, they can quietly increase stress on the cardiovascular system without producing immediate warning signs. Once you understand how these medications interact with the aging body, you'll begin seeing them differently, not with fear, but with greater awareness. And awareness is often the first step toward protecting your long-term heart health. Let's begin with one of the most familiar medications in the world, one that many people keep in their kitchen cabinet and use without giving it a second thought. The first medication on our list is one that almost everyone recognizes. Many people reach for it whenever arthritis flares up, back pain becomes unbearable, or sore joints make everyday activities uncomfortable. We're talking about a group of medications called non-steroidal anti-inflammatory drugs, more commonly known as NSAIDs. This category includes familiar names such as ibuprofen, naproxen, and several prescription-strength anti-inflammatory medicines that doctors frequently recommend for chronic pain. It's easy to understand why these medications are so popular. They work quickly, reduce inflammation, ease stiffness, and help people remain active. For someone dealing with knee arthritis or persistent muscle pain, they can make daily life much more comfortable. In many situations, they're effective and entirely appropriate. The concern begins when they're used regularly for months or even years, without considering how the aging body responds to them. To understand why, let's look at what these medications actually do inside the body. NSAIDs reduce pain by blocking enzymes that produce inflammatory chemicals. That's the reason swelling decreases and painful joints begin feeling better. But those same enzymes have another important responsibility. They also help maintain healthy blood flow through the kidneys and support the normal function of blood vessels throughout the cardiovascular system. When these protective pathways are blocked day after day, subtle changes begin taking place. Blood vessels become slightly more constricted, making it harder for blood to move freely. As those vessels tighten, blood pressure can gradually increase. Most people never notice this happening because it develops slowly, rather than all at once. There isn't usually a dramatic symptom telling you your blood pressure has risen over the past several months. At the same time, NSAIDs can interfere with the kidney's ability to regulate sodium and water. Instead of eliminating excess fluid efficiently, the body may begin holding on to more salt and water than it should. That additional fluid increases the volume of blood circulating through the body, forcing the heart to work harder with every beat. Now imagine combining those two effects. Blood vessels become narrower, while the amount of fluid inside them increases. The cardiovascular system suddenly has to push a greater volume of blood through tighter arteries. In younger adults, the heart often compensates remarkably well. But after 60, when arteries naturally become stiffer and less flexible, that additional workload may become much more significant. Large clinical studies have consistently shown that frequent or long-term NSAID use is associated with an increased risk of heart attack, stroke, worsening heart failure, and elevated blood pressure, particularly among older adults or individuals who already have cardiovascular disease. The important point isn't that every person taking ibuprofen is in immediate danger. The important point is that prolonged use deserves periodic review instead of becoming an automatic daily habit. One reason these medications are often underestimated is because the benefit appears almost immediately. Within an hour, pain begins improving. Stiff joints loosen. Walking becomes easier. The relief is obvious and reassuring. Meanwhile, the cardiovascular effects develop so gradually that they remain completely unnoticed until routine blood pressure readings begin climbing, or a more serious complication eventually appears. This doesn't mean NSAIDs should never be used after 60. In many situations, they remain valuable medications when used appropriately. Short courses for temporary injuries, carefully supervised treatment plans, and individualized dosing may all be reasonable depending on a person's overall health. The message isn't avoidance, it's awareness. If you've been relying on these medications regularly for months or years, it's worth asking whether they're still the safest option for your current stage of life. Sometimes, the answer may simply involve using the lowest effective dose. Sometimes, your physician may recommend limiting how frequently you take them. In other cases, physical therapy, topical anti-inflammatory treatments, exercise programs, or other pain management strategies may reduce the need for continuous medication. The important thing is making that decision deliberately, instead of assuming nothing has changed. Now let's move to the second medication, because unlike pain relievers, this one doesn't usually raise concern at all. In fact, many people think of it as one of the safest prescriptions they take. It's commonly prescribed for heartburn, acid reflux, stomach ulcers, or to protect the stomach while taking other medications. We're talking about proton pump inhibitors, often called PPIs. Medications such as omeprazole, esomeprazole, pantoprazole, and lansoprazole have transformed the treatment of acid-related disorders. For people suffering from severe reflux, these medications can dramatically improve quality of life. They reduce stomach acid, relieve burning discomfort, and allow damaged tissue inside the esophagus to heal. Because they work so well, many patients continue taking them for years. Some never revisit the original reason they were prescribed. Refills continue automatically, symptoms remain controlled, and everyone assumes there's no reason to reconsider the treatment. But stomach acid serves a much larger purpose than simply creating heartburn. It plays an essential role in breaking down food and helping the body absorb several nutrients that are critical for healthy cardiovascular function. When stomach acid remains suppressed for long periods, absorption of magnesium, calcium, and vitamin B12 may gradually decline. Magnesium is particularly important because it helps regulate normal heart rhythm, supports muscle contraction, and contributes to healthy blood vessel function. Chronically low magnesium levels can increase the likelihood of abnormal heart rhythms and other cardiovascular complications, especially in older adults whose reserves may already be lower than they were decades earlier. Calcium is equally important, not only for bone strength but also for proper muscle function, nerve signaling, and blood vessel health. Vitamin B12 supports healthy nerve tissue, red blood cell production, and normal metabolism. Deficiencies don't usually appear overnight. Instead, they develop slowly, often remaining unnoticed until symptoms become more pronounced. Researchers have also explored another possible concern involving long-term PPI use. Some evidence suggests these medications may influence the health of the endothelium, the thin inner lining that covers every blood vessel in the body. This remarkable tissue helps regulate blood flow, controls vessel relaxation, and plays an important role in maintaining cardiovascular health. When endothelial function becomes impaired, blood vessels may not respond as efficiently to changing demands. Circulation becomes less adaptable, and over many years, this may contribute to a gradual increase in cardiovascular vulnerability. Although researchers continue studying this relationship, it illustrates why medications that seem unrelated to the heart can still influence cardiovascular health in unexpected ways. Perhaps the biggest issue isn't the medication itself, but how easily long-term use becomes automatic. Many people begin taking a proton pump inhibitor after a temporary episode of severe reflux or while recovering from another illness. The original problem improves, yet the medication quietly remains part of the daily routine for years without anyone asking whether it's still necessary. That doesn't mean everyone should stop taking these medications. For many people, they remain extremely important and provide benefits that clearly outweigh potential risks. The key is periodic reassessment. Your physician may determine that continuing treatment is absolutely appropriate. In other situations, a lower dose, shorter treatment schedule, or alternative strategy may provide the same relief with fewer long-term concerns. The common thread connecting these first two medications is surprisingly simple. Neither becomes automatically dangerous simply because you turned 60. Instead, the balance between benefit and risk gradually changes as your body changes. That's why regular medication reviews become increasingly valuable with age. So far, we've explored medications that primarily influence blood pressure, circulation, and nutrient balance. But the next category affects something even more fundamental. It influences how the brain, heart, and nervous system communicate with one another every single day. And for many older adults, that interaction can quietly reshape cardiovascular health in ways few people ever suspect. Now we're moving into a category of medications that many people never associate with heart health at all. Unlike pain relievers or acid-reducing drugs, these prescriptions aren't designed to treat the cardiovascular system. Instead, they're commonly prescribed for anxiety, insomnia, panic attacks, or to help people feel calmer during stressful periods. Yet after the age of 60, they can indirectly place additional strain on the heart in ways that are often overlooked. The third group of medications includes benzodiazepines. You may recognize names such as diazepam, lorazepam, clonazepam, or alprazolam. These medications have been prescribed for decades because they work quickly and effectively. They calm the nervous system, reduce feelings of anxiety, ease muscle tension, and help many people fall asleep when nothing else seems to work. For someone struggling with persistent anxiety or chronic insomnia, these medications can feel life-changing. They provide relief during difficult periods and, when used appropriately, they have an important role in modern medicine. The concern develops when they continue being used for long periods, without considering how aging changes the body's response. Benzodiazepines work by slowing activity within the central nervous system. That's what creates the calming effect. Brain signals become less active, muscles relax, and feelings of tension begin fading. But those same effects don't stop with anxiety alone. They also influence reaction time, balance, breathing patterns, coordination, and overall alertness. As we grow older, these medications remain in the body much longer than they once did. The liver processes them more slowly, and the kidneys remove them less efficiently. A dose that produced mild relaxation at age 50 may create much stronger effects 20 years later, even when nothing about the prescription has changed. This increased sensitivity can gradually influence daily life in subtle ways. People may become less physically active without realizing why. They may spend more time sitting, avoid exercise because they feel slightly unsteady, or simply move less throughout the day because their energy isn't what it once was. At first glance, that may not seem related to cardiovascular health. But movement is one of the most powerful tools the body has for maintaining healthy circulation. Every step you take helps muscles push blood back toward the heart. Regular movement improves oxygen delivery, supports healthy blood vessels, and reduces the tendency for blood to pool in the legs. When activity gradually declines, circulation becomes less efficient. Blood flow slows, muscles weaken. Overall, cardiovascular conditioning begins to decrease. Over time, this combination can contribute to an increased risk of blood clots, worsening heart health, and reduced physical resilience. There's another important consideration as well. Benzodiazepines may influence breathing while you sleep. In some individuals, particularly those who already have sleep apnea or other nighttime breathing disorders, these medications can make breathing shallower or less effective throughout the night. Even small reductions in nighttime oxygen levels can gradually place additional stress on the cardiovascular system. The heart must work harder to compensate for repeated drops in oxygen, and over months or years, that additional workload may become significant, especially in someone who already has high blood pressure or existing heart disease. What makes this especially challenging is that the symptoms rarely seem alarming. People often describe feeling more tired during the day, slower in the morning, or less energetic than they used to be. Many assume these changes are simply part of getting older, when in reality, the medication may be contributing to the problem. Research has consistently shown that long-term benzodiazepine use in older adults is associated with increased risks of falls, fractures, reduced mobility, and cognitive slowing. While these medications don't directly cause heart attacks, the chain of effects they create can gradually increase cardiovascular vulnerability over time. This doesn't mean every person taking a benzodiazepine should stop immediately. In many situations, these medications remain appropriate, particularly when used for short periods or under careful medical supervision. The important question is whether the current prescription still matches the needs of your body today, rather than the body you had years ago. Sometimes physicians gradually reduce the dosage. Sometimes alternative treatments for anxiety or insomnia become better long-term choices. The right answer depends entirely on the individual. What matters most is regularly reviewing whether the benefits continue, outweighing the risks. Now let's turn to another medication category that surprises many people, because it's available without a prescription in many pharmacies. People often purchase it while treating a simple cold or seasonal allergies, never realizing it may temporarily affect the cardiovascular system. The fourth category includes decongestants, containing ingredients such as pseudoephedrine or similar stimulant-like compounds. They're found in many cold remedies, sinus medications, and combination products designed to relieve nasal congestion quickly. These medications work by narrowing blood vessels inside the nasal passages. As those tiny blood vessels constrict, swelling decreases, allowing air to move more freely through the nose. That's why people often feel relief within a short period after taking them. The problem is that this narrowing effect doesn't remain limited to the nose. Blood vessels throughout the body respond as well. As arteries become slightly narrower, blood pressure can increase, heart rate may rise, and the heart must generate greater force to circulate blood effectively. For younger adults with healthy, flexible arteries, this temporary increase is often well tolerated. But after 60, the situation changes. Blood vessels naturally become stiffer with age, making it harder for the cardiovascular system to adapt to sudden increases in pressure. If someone already has hypertension, coronary artery disease, or an irregular heartbeat, even a temporary rise in blood pressure may become much more significant than expected. That's why many physicians recommend extra caution when older adults choose over-the-counter cold medications. What makes this issue even more complicated is that many people don't take just one medication anymore. A typical older adult may already be taking prescriptions for blood pressure, cholesterol, arthritis, diabetes, or sleep. Then cold season arrives, and a decongestant is added without considering how it interacts with everything else. Each medication may be perfectly reasonable on its own, but together they can create competing effects inside the body. One medication relaxes blood vessels, while another constricts them. One influences fluid balance while another raises blood pressure. Another slows the nervous system, while another stimulates it. The body constantly works to maintain balance, but every additional medication increases the complexity of that task. Eventually, the combined effects may place considerably more stress on the cardiovascular system than any single medication would have caused alone. This is why medication interactions become increasingly important with age. It's not always one prescription creating a problem. More often, it's the combination of several medications, together with age-related changes, that gradually shifts the balance toward increased cardiovascular risk. Fortunately, this is also one of the easiest problems to address. Before purchasing an over-the-counter cold or allergy medication, ask your pharmacist whether it's appropriate if you have high blood pressure or heart disease. That simple conversation may help you avoid an unnecessary increase in cardiovascular strain. We've now discussed 4 medication categories that often receive less attention than they deserve after age 60. Each one illustrates the same important lesson. The medication itself isn't automatically harmful. The key is understanding how your body has changed and recognizing when familiar medications deserve a fresh review. But we're not finished yet. The 5th and final medication may be the most surprising of all, because for decades it was recommended by physicians around the world as one of the simplest ways to protect the heart. Today, however, our understanding has changed dramatically, and what we've learned has reshaped medical recommendations for millions of older adults. The 5th medication is one that almost everyone has heard about. In fact, for many years it was considered one of the simplest ways to help protect the heart. Doctors routinely recommended it, families encouraged one another to take it, and millions of adults added it to their morning routine without giving it a second thought. We're talking about low-dose aspirin. For decades, aspirin earned a reputation as an inexpensive way to reduce the risk of heart attacks and strokes. By making platelets less likely to stick together, it lowers the chance of blood clots forming inside arteries. For people who have already experienced a heart attack, stroke, or certain cardiovascular procedures, that effect can be life-saving. In those situations, aspirin continues to play an important role and remains part of standard medical treatment for many patients. However, medical research never stands still. As larger and longer clinical studies became available, researchers began asking a different question. What about adults who have never had a heart attack or stroke? Should everyone over 60 continue taking aspirin simply as a preventive measure? The answers were more complicated than many experts expected. The newer evidence showed that while aspirin can reduce clot formation, it also reduces the body's natural ability to stop bleeding. That trade-off is important because aging changes blood vessels in ways that make bleeding complications more likely. The stomach lining becomes more delicate. Blood vessels throughout the digestive system become more fragile. Even tiny blood vessels inside the brain become increasingly vulnerable over time. When aspirin decreases the blood's ability to clot, these age-related changes become much more significant. A minor irritation in the stomach may bleed more easily. A small blood vessel that might have sealed itself years earlier may continue bleeding longer. Most people never notice these changes until a serious complication develops. This creates an important balance that physicians now evaluate much more carefully than they did in the past. On one side is the potential benefit of preventing dangerous blood clots. On the other side is the increased possibility of bleeding. For someone who has already suffered a heart attack, the benefit usually outweighs the risk. For someone with no history of cardiovascular disease, the calculation may be completely different. One area that often causes confusion involves strokes. Many people think all strokes happen for the same reason, but that's not true. Some strokes occur because a blood clot blocks circulation to part of the brain. Others happen because a weakened blood vessel ruptures and bleeds. Aspirin may lower the risk of clot-related strokes, while at the same time increasing the likelihood of bleeding-related strokes in certain individuals. This is exactly why many medical guidelines have evolved over recent years. Rather than recommending aspirin broadly for everyone over a certain age, physicians now focus on individual risk factors. Personal medical history, blood pressure, diabetes, smoking history, cholesterol levels, and previous cardiovascular events all help determine whether aspirin provides more benefit than risk. Many people began taking low-dose aspirin years ago because it was considered routine preventive care. They simply continued taking it year after year without ever revisiting the decision. Nothing seemed wrong, so there appeared to be no reason to change. But medicine changes as new evidence becomes available, and recommendations that were appropriate 15 or 20 years ago may no longer apply in exactly the same way today. That doesn't mean aspirin suddenly became unsafe. It means the decision to use it should be individualized rather than automatic. Some people absolutely benefit from continuing therapy. Others may discover that the potential risks now outweigh the expected advantages. Only a healthcare professional who understands your complete medical history can help make that determination. As we've moved through these 5 medication categories, a common pattern has emerged. None of these medications are inherently bad. Every one of them has an important place in modern medicine. Millions of people benefit from them every day. The concern begins only when aging changes the body's response, while the treatment plan remains exactly the same. This is where you regain control over your health. The goal isn't to become suspicious of every prescription or over-the-counter medication. The goal is to recognize that your body changes with time, and your medication plan should occasionally change with it. One of the most valuable habits you can develop after 60 is scheduling regular medication reviews. Instead of waiting until something goes wrong, ask your physician or pharmacist to review every medication you're taking, including vitamins, supplements, and non-prescription products. Sometimes a simple adjustment in dose is all that's needed. Sometimes an alternative medication offers the same benefit with fewer risks. And sometimes you'll discover that everything you're taking remains exactly right for you. Another important habit is paying attention to combinations. The greatest risk often isn't one medication by itself. It's several medications working together in ways that weren't obvious at first. Prescription drugs, over-the-counter pain relievers, cold medicines, herbal supplements, and even certain vitamins can influence one another. That's why it's so important to let every healthcare provider know everything you're taking. It's also worth listening carefully to the small signals your body gives you. Changes in energy, unusual dizziness, swelling in the legs, shortness of breath, balance problems, or unexplained changes in blood pressure may all deserve attention. These symptoms don't always indicate a serious problem, but they can be early clues that something needs to be reviewed before it becomes more significant. Perhaps the most important lesson from today's discussion is that aging doesn't automatically make medications dangerous. It simply changes the context in which they're used. The body processes drugs differently, responds differently to stress, and recovers differently than it did years ago. Recognizing those changes allows you and your healthcare provider to stay one step ahead instead of reacting after complications develop. Think about the 5 medication groups we've discussed today. NSAIDs may gradually increase blood pressure and fluid retention. Proton pump inhibitors may influence nutrient absorption and long-term vascular health. Benzodiazepines can affect movement, breathing, and circulation. Decongestants may temporarily increase cardiovascular strain. And aspirin, while life-saving for some people, now requires much more individualized decision-making than it once did. Each medication serves an important purpose. Each can improve quality of life when used appropriately. But every medication also deserves periodic review as your body continues changing with age. That's one of the most powerful steps you can take to protect your heart and maintain your health over the years ahead. At your next medical appointment, consider asking one simple question. Are all of my current medications still the best choice for me at this stage of life? That single question often leads to conversations that help optimize treatment, reduce unnecessary risk, and ensure your medications continue working for you rather than against you. If today's video helped you see your medications from a new perspective, don't keep this information to yourself. Share it with a family member or friend who takes medications every day, especially someone over the age of 60. One conversation could encourage them to review their medications and potentially prevent future health problems. And before you leave, make sure you subscribe to Dr. Andewala and turn on the notification bell. Every week, we bring you evidence-based health information, practical medical insights, and easy-to-understand explanations designed to help you live a longer, healthier, and more active life. If you found this video valuable, let us know in the comments which of these 5 medications surprised you the most and what topic you'd like us to cover next. Thank you for watching. Take good care of yourself, and I'll see you in the next video.